Hello, my name is Matthew Wiles. Today I will be discussing how to perform an abdominal assessment. We would perform an assessment on a patient to monitor their gastrointestinal status and look for abnormalities that may indicate problems. Before you assess the patient, make sure you have gathered your equipment such as a stethoscope and a towel or blanket. You will use the stethoscope to listen for bowel sounds and the towel or blanket to keep the patient warm while their abdominal region is exposed. Remember to perform hand hygiene. You can do this while introducing yourself to the patient, briefly explaining the procedure and asking for their consent. Now you can gather information about their gastrointestinal history. This history should include the following: family history or previous history of gastrointestinal problems, abdominal, back, or esophageal pain, weight, usual and current appetite, and their usual diet, smoking and alcohol history, and sleep difficulties associated with gastrointestinal pain. Also ask about symptoms such as nausea, vomiting, bloating, flatulence, constipation, and diarrhea. You also need to find out if they are taking any medications, including over-the-counter medications like antacids, laxatives, and stool softeners. It is now time to begin the physical assessment. Ask the patient if they need to empty their bladder, as it will be uncomfortable to palpate the abdomen on a full bladder. Make sure the patient is in a comfortable position, such as a supine position, with their head supported by a pillow. Ensure privacy and remove their clothing up to the costal margin and down to the symphysis pubis. At this time you may offer the towel or blanket to cover their torso to provide warmth. Identify the landmarks such as the umbilicus, the symphysis pubis, and the xiphoid process of the sternum. It may help to visually divide the abdomen into 4 anterior quadrants, using the umbilicus as the center point. Inspect from the rib margin to the symphysis pubis. Look at the general contour and symmetry of the abdomen. If the person is female, is there a linea nigra? Observe abdominal movement during respiration. Normally it rises and falls with inhalation and exhalation. Can you see the bowel activity in a slender person? Visible peristalsis slowly transverses the abdomen in a downward slanting movement. Is there pulsation near the xiphoid sternum? Abdominal aorta pulsations are visible in many thin people. Observe the umbilicus for abnormalities, color, contour, discharge, or protuberance, and is usually midline, depressed beneath the abdominal surface. Auscultate quadrants in sequence. Do this systematically, first listening with the diaphragm to the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. This follows the anatomical lie of the large intestine and reduces the possibility of missing a quadrant. Listen over the ileocecal valve. Bowel sounds should be audible. Listen for high-pitched gurgles, clicks, and other soft sounds occurring from 5 to 30 times per minute. Borborygmi or hyperactive loud bowel sounds, like stomach growls, are normal. Listen for low-pitched murmuring sounds in the epigastric region and the lower quadrants. Vascular sounds are generally abnormal and need to be reported. Next, you will need to palpate the abdomen. Use light palpation to determine any areas of tenderness, abnormal masses, or distension. Palpate up to 2 cm into the surface of the abdomen, ensuring not to palpate where low-pitched murmuring sounds or bruits were detected during auscultation. If the patient has pain, commence palpation in the quadrant furthest away from the pain. If tenderness is found, palpate that area last. With deep palpation, the hand is pressed further into the abdomen to feel the deeper structures and to determine size and consistency of any masses found. Palpate for the edge of the liver and for rebound tenderness. The liver's lower edge can be felt, with the fingers of the right hand on the person's right upper quadrant, just below their costal margin. Normal livers are non-tender, feel solid, and have a regular and sharp lower edge. Find the upper edge of the liver by percussing the right mid-clavicular line of the chest downwards until the lung resonant sound gives way to the liver's dull sound. Rebound tenderness indicates an inflamed peritoneum. Press slowly and deeply into the painful area. Then quickly withdraw your hand. Increased pain means the test is positive. You have now completed the gastrointestinal assessment. Let the patient know they are free to adjust their clothing and assist them into a comfortable position. Remember to clean and replace any equipment that you have used during the assessment. Make sure you thoroughly document any bowel sounds and the presence of any pain or abnormalities in the progress notes. Thank you for listening.
Created using Powtoon.